This topic is verbal communication. Verbal communication includes spoken and written words. It's the content of what is being said. It's one way we can communicate values and beliefs, meaning and perception. It can convey that you are interested and that you understand, or it can be insulting and judgmental. It allows us to deliver information, messages, and feelings, and it can demonstrate intellectual development, education level, and where a person is from. Communication levels. There's intrapersonal, that's self-talk. It boosts positive self-esteem, or the opposite, depending upon how you speak to yourself. It can decrease factors that distort ability to care for clients. An example could be the difference between being faced with a challenge and telling yourself, "Oh, this is way too hard, I'm never going to be able to do this." Or saying, "I can do this, I'll take it one step at a time, I've done hard things before, and I can get this done." Interpersonal. This is direct, one-on-one. It can be face-to-face or done electronically. This is the most common type of communication for nurses. It's exchanging information with clients, family members, and the healthcare team. Small group. This is 2 or more people. There's a goal. It results in an outcome and involves group dynamics. It can be nurse committees, staff meetings, client care conferences, or support groups. Public. This is in front of an audience. It includes doing a community information program, being a teacher, presenting information at a nursing conference. It incorporates nonverbal communication with eye contact and body gestures. The goal is to increase the knowledge of the group or audience about a topic. Electronic. This is utilizing technology. Hospital and clinics now have client portals. The client can now send the doctor messages electronically and receive information back the same way. This requires proper etiquette to ensure that the messages are interpreted accurately. We always want to keep professional guidelines in mind when communicating this way. Circular Transactional Model of Communication, CTMC. Communication is ongoing and always changing when an interaction is occurring. Each participant is a sender and receiver, each sending and receiving information, because communication is a continuous cycle. You can see that here in the image. The cycle of communication between sender and receiver, and that those roles are always being transferred. Also, you can see how the message is affected by context, environment, and interpersonal variables. I also want us to understand encoding and decoding. Encoding is the process of the sender converting information into a message. Decoding is the process of the receiver interpreting that message into understandable information. You can see the different elements of CTMC listed here. We'll talk about all of these individually as we continue. The referent, sender and receiver, message, channels, context and environment, feedback, and interpersonal variables. Elements of CTMC. Referent. This is what encourages an individual to initiate communication with another person. It could be a want or a need, a sound or something that's seen. It's a stimulus. An example is a client who is asking when they're going to go home, or a client in pain and asking for pain medication. The sender converts that information, the need, motivation, or stimulus, and encodes it, sends that message via verbal and nonverbal pathways. The receiver receives the message from the sender, and then this becomes the referent for the receiver. They then interpret and decode the message into understandable information. The message is the communication topic. This is delivered in verbal and nonverbal ways. An effective message is clear and presented in an effective way for the receiver to understand. We need to keep in mind the level of the client's understanding. This will affect how we communicate with the client. like how we describe things and answer questions. We can watch nonverbal cues to see if they are understanding the message or if we need to explain something differently. Channels. This is the route or sense the communication is being sent and received. Visual, what we see, facial expressions, body language, or even an information chart. Oral, what we hear. This is verbal communication. What is said and how it is said. The words used, the tone and inflection and volume. Tactile. This is what we sense via touch. What can we place our hands upon? Maybe a hot area of an infected wound. Communication is more effective when multiple channels are utilized. Let's think of an example. Maybe learning how to place an indwelling urinary catheter. Imagine only hearing the steps in a lecture, nothing else, and then having to do it. Now imagine the lecture and then seeing a demonstration. That might be a little bit better and then having to do it. And now imagine probably how you all learned, with a lecture, a demonstration, and then practicing hands-on how to complete the skill. When multiple channels are used, communication is more effective. Feedback. This is return communication from the receiver back to the original sender. It tells the sender how well the receiver has understood the meaning of a message. Interpersonal variables. These are in the sender and receiver, and they affect communication. They can include culture, life experiences, education level, values and beliefs, and physiologic state. Is the client in pain? Are they having an adverse effect from a medication? Are they alert? We cannot know each client's full life experience, so we need to have humility when communicating with our clients, to understand that what we are trying to communicate might not be what they are receiving, and so then we have to make adjustments. Environment. This is the setting for communication. We want to make sure it's comfortable for all persons involved, the sender and the receiver. We want to avoid distractions and discomforts. Think of what that could include in the hospital: privacy and being overheard, noise, distractions from other nurses or other clients. A better environment for the sender and receiver will help make communication more effective for both.